Good morning, everybody. Hear he, we are talking about alprazolam.
What?
What about novo alprazole?
No. What? No. Never.
Okay, you guys definitely know what this drug is. Xanax!
Oh, Xanax! Yeah.
Yes, Xanax. Alprazolam is also known as Xanax. Xanax is a benzodiazepine, and its therapeutic class is an anxiolytic and anti-panic drug. That really just means in fancy terms that it is a medication that helps with people with anxiety and anxiety disorders. Some of the adverse effects of Xanax is hypotension, tachycardia, as well as respiratory depression. Brandy, could you tell me some other side effects or adverse effects of Xanax?
Drowsiness and slurred speech.
Hey, is this class 21, 28?
Yes, absolutely. Does anybody else have any other adverse effects? Yes, go ahead, Kalina.
Impaired recall of events.
Yes. Does anyone else have any other adverse effects? Michael!
Some of them are tolerance and physical dependence. Others are withdrawal symptoms like insomnia, anxiety, tremors, diaphoresis, dizziness, and hypertension with seizures.
So I went to the DMV, right? And I got really nervous before my appointment, and I just kept tremoring.
Why?
I don't know.
Johnny, I haven't heard from you at all. Can you give us some adverse effects of Xanax?
Well, some signs for overdose and toxicity could be confusion, sedation, and then possibly cardiac arrest.
6, 7, 8, 9, 30. 1, 2. Wake up! Help!
Yeah, that was great, you guys. Those are some great examples of some adverse effects. The very last thing that I want to go over is just some of the patient instructions and stuff that you're going to be wanting to educate your patient on while they're taking Xanax. So we want to instruct our patients to use care with ambulation or when driving or using hazardous equipment. We want to advise our patients that amnesia may occur, so that random forgetfulness and the impaired recalling of events. Some other instructions is to teach our patients to avoid from increasing the dose from the prescribed dose, as well as that when it comes to discontinuing the drug, that it must be tapered over 1 to 2 weeks to prevent withdrawal symptoms. The most last important thing is that instruct their patients to change their position slowly to prevent falls, because it can cause hypotension and that low drop of blood pressure. We just don't want them to faint and fall. If any sign of symptoms of drug toxicity occurs, we want to have them make sure that they let their provider know or wherever that they are taking Xanax, so we know that the reversal drug is flumazenil.
Man, what that class about?
I thought that was Spanish class.